Table of content: non communicable diseases, NCDs, and the importance of surveillance. Overview of artificial intelligence (AI) and its application in non communicable diseases surveillance. AI in improving risk factor identification and prediction in NCD surveillance. AI in disease diagnosis and prediction. AI driven disease identification. Challenges and opportunities. References: non communicable diseases (NCDs) and the importance of surveillance. Non communicable diseases (NCDs) are chronic conditions that are not transmitted between people. NCDs are primarily caused by modifiable risk factors such as unhealthy diet, physical inactivity, tobacco use, and the harmful use of alcohol. NCDs include cardiovascular diseases, cancers, chronic respiratory diseases, and diabetes, and they account for a significant proportion of global health and disability. NCD surveillance involve the ongoing systematic collection and analysis of data to provide information on countries' NCD's burden, population group at risk, estimate of NCD mortality, morbidity, risk factors and determinants, as well as the response of national system. Surveillance of NCDs is essential for monitoring and evaluating emerging patterns and trends, as well as for better prevention and management. Overview of artificial intelligence and its application in non communicable diseases surveillance. Artificial intelligence (AI) has the potential to significantly improve diagnostic, treatment, and support in managing non communicable diseases (NCDs). AI can analyze large and complex data sets of medical and health big data to improve predictive, preventive, and personalized medicine. AI has been applied in risk satisfying of disease, risk factor screening, diagnosis, prognosis, and evaluation of therapeutic uses. AI models, predominantly deep learning and machine learning, have been used to detect, diagnose, classify, manage, treat, and monitor prognosis of various health issues, including communicable disease, NCDs, and mental health. AI in improving risk factors identification and prediction in NCD surveillance. AI can significantly improve risk factor identification and prediction in NCD surveillance through the following application: risk stratification. AI algorithm can analyze large and complex data sets to identify individuals at high risk for NCDs, allowing for targeted interventions and prevention strategies. Early detection. AI can use to detect NCDs risk factor and early signs of disease. Personalized medicine. AI can help tailor prevention and treatment strategies to individual patient based on the unique risk profiles. Predictive modeling. AI can be used to predict the likelihood of developing NCDs based on the risk factors, allowing for early intervention and prevention. Population level analysis. AI can be used to analyze population level data to identify trends and patterns in NCD risk factor, enabling targeted intervention and policy development. AI in disease diagnosis and prediction. Artificial intelligence has shown significant promise in the diagnosis and prediction of various diseases, particularly through the use of deep learning and machine learning techniques. AI is being applied to medical imaging, laboratory test results, and other data sources to improve the accuracy and efficiency of disease detection and treatment. They can analyze medical imaging such as X-rays, CT scan, and MRIs to identify patterns and features that may be indicative of diseases. This technology has been applied to diagnose and predict diseases like cancer, diabetes, chronic heart disease, tuberculosis, and COVID-19. The use of AI in disease diagnosis and prediction is constantly evolving, and new techniques are being developed or combined to improve the accuracy and efficiency of medical diagnosis. AI driven disease identification. AI and machine learning (ML) techniques has been used to improve the identification, prediction, and management of non communicable diseases (NCDs). These approaches leverage big data to enhance disease surveillance, risk Utilizing big data for disease surveillance, AI algorithm can analyze large and complex data sets to identify disease drivers and risk factors for NCDs. Big data sources include electronic health record, medical images, wearable devices, and real-world evidence (RWE). Machine learning models for NCD identification. ML models can predict the risk of NCD, identify individual at high risk, and help with early interventions. Examples of animal techniques include random forest, decision trees, and deep learning DL method. AI tools for the identification of disease drivers for NCD surveillance. Machine learning algorithms such as random forest that have been used to predict the spread of infectious disease and identify transmission patterns. Deep learning models which have been applied to analyze imaging data for disease classification, detection, segmentation, characterization, and monitoring. Fuzzy K-means clustering algorithm, COVID inception resonate model, and other deep learning techniques that have been used to predict disease risk and diagnosis. Natural language processing and neural network models that have been used to analyze medical record and electronic health record EHR for disease prediction and diagnosis. Long short term memory LSTM networks which have been used to predict disease progression and mortality in patients infected with emerging infectious diseases. Challenges and opportunities. The use of artificial intelligence (AI) in disease surveillance presents both opportunities and challenges. While AI has the potential to improve disease identification, prediction, and management, ethical consideration and future implications must be carefully considered. Ethical consideration in AI driven surveillances. AI algorithms must be transparent and explainable to ensure that they are not biased or discriminatory. Data privacy and security must be ensured to protect patients' confidentiality and prevent data breaches. The use of AI in healthcare must be guided by ethical principles such as beneficence, non maleficence, and respect for autonomy. Future prospect and implications. AI has the potential to revolutionize disease surveillance, allowing for more accurate and efficient disease identification, prediction, and management. The integration of AI in healthcare could be lead to more personalized medicine tailored to individual patient need and characteristics.